How do you view people who kill children? With disdain? How about people who enable children to kill themselves? Same answer. Childhood obesity is 100% preventable. We can all make a difference. Childhood obesity is a serious medical condition that occurs when a child is well above normal weight for his or her height and age. But is it really such a big deal? Childhood obesity is an epidemic that is 100% preventable. So first we'll discuss what experts say about the obesity in children between the ages of 6 and 11. Next we'll discuss the risk factors and complications. And finally, treatment and prevention. Page 1 gives you an image of childhood obesity. After years of increase over the years, it's finally plateaued at 32%, or 1 in 3 children between the ages of 6 to 11. And page 2 of your handout actually shows an increase in the plateau, as taken from Time magazine. Cynthia Ogden of the CDC says we can be cautiously optimistic that the epidemic has plateaued, but is it really a good sign? It's still 1 in 3 children. Dr. Ludwig of the Children's Hospital of Boston says that the childhood obesity epidemic is a tsunami, and we're beginning to see the wave hitting the stone. The risk factors and complications associated with this illness are astounding. The U.S. Department of Health and Humane Services states that overweight adolescents have a 70% chance of becoming overweight adults, and increases to 80% if one or more of their children, or their parents rather, are overweight. Page 3 of your handout shows the risk factors for children that may wind up in this situation. The first one is poor diet, inactivity, genetics. Psychological factors is, are you using food as a way to enable or disable your child from doing some sort of action? You can be causing a dependency on food. Also, family factors. The parents are the ones that go to the grocery store and buy the food, not the children. And then finally, socioeconomical factors. It's been shown that poverty and obesity go hand in hand. There are poor choices that are available for poverty budget, but organic foods tend to be very expensive and only a few can afford them. But what are the complications? Page 4, type 2 diabetes in a child between the age of 6 and 11 is absurd. High blood pressure, sleep disorders, liver disease, eating disorders, skin infections, but it goes beyond that. Children tend to have low self-esteem, behavioral problems, even depression. They can even find themselves at the hand of a bully. The Dr. Ludwig aforementioned states that the impact of this epidemic will be felt with increasing severity for many years to come. But is there any hope? The Mayo Clinic advocates prevention as the best way to stop the illness. Page 5 of your handout speaks of treatment. Healthy eating, physical activity, simplest things. But also medications, weight loss surgery, something very drastic for a 6-year-old to go through. Prevention would be taking your child to a yearly visit to his or her doctor. Also, setting a good example. Are you using food as a crutch? And emphasize the positive. What changes is the child making in their habits? And finally, we need to be patient. Weight loss comes on over time and it comes off over time. In summary, childhood obesity affects 1 in 3 children between the ages of 6 and 11. Its complications, its risk factors outweigh the treatment and the prevention. It's basically a no-brainer what to do. So, in conclusion, we can be a good example. We can save our children to enable them to grow up to be healthy and strong adults. Thank you.